So next, we are going to hear about gays versus gays from Jared Starr. Jared has been working with LGBTQ people in Winnipeg and Manitoba for over 4 years in a variety of roles. While most have been directed towards youth, Jared has more recently been focused on providing sexual health education programming and counseling to gay and bisexual men. This includes coordinating and directing the Totally Outright and Towel Talk programs and providing consultations when requested to local agencies and professionals. His values are rooted in social justice and anti-oppressive theory and practice. Jared is close to completing a degree in social work, spends his spare time volunteering in community health centers, and sometimes you can find Jared DJing local clubs and parties when his schedule allows it. Please welcome Jared.
Thank you for the introduction, and thank you for your help. I couldn't remember what bio I'd sent in, so I was thinking to myself, like, oh, I think I missed a few things, but that's pretty much it, so I'm glad I sent you the right one. No problem. So my name is Jared, and I work at the Rainbow Resource Center in Winnipeg, Manitoba. The Rainbow Resource Center is the longest continuously running LGBTQ center in Canada and possibly North America. I'm not entirely sure, but I know what we usually say is Canada. That's not the right one. That's okay. All good. Nope, that's not mine either. All right. Good? Good? Great. So this presentation, so Rainbow Resource Center, that's in Winnipeg, and there I coordinate the youth program and a variety of little projects and things that we do throughout the year, including Totally Outright and Towel Talk, which are the most relevant to you. So I'll focus in that area of my role at the Rainbow Resource Center. And this presentation is called Gays versus Gays, and I'll explain where that title comes from in a minute. How stigma continues to reinforce intragroup isolation within the local gay, bi, queer, and two-spirit men's community of Winnipeg. So I'm just going to introduce, like I've already started, a little bit about me and the program and how Totally Outright started in Winnipeg and what it's doing now. And then I'm going to talk a little bit about some nuanced issues taking place in Winnipeg that are really impacting the lives of young gay and bisexual men. And all of that information really comes from anecdotal feedback and discussions that young guys are starting to have in Winnipeg, which is really lovely because for a long time there's a lot of silence and a lack of permission around having conversations like that. So, and then I'll present, again, I'll present the problem and show you a solution, and then show you a video. So my slides are really boring, so I'm sorry, so just bear with me, but the video is really great. So if you can make it to the video and disregard the slides, I promise you'll be satisfied. That's a promise. Okay, so this is a picture of some of the work we like to do. This is out front of the legislature in Winnipeg. Some of my colleagues, we're very active in the community, and with a very small staff, we do a lot of really great work, so I'm very proud to work there. So Totally Outright in Winnipeg started in 2013. In the fall of 2013, we adapted the program by looking at the Vancouver model and by looking at the Toronto model and sort of blending them together to create something that met our needs. Winnipeg's context is very different than larger urban centers because of its location and its population size, and also because of some of the other factors going on, which we'll get to in a minute. So we just completed our third successful run of the program in May. We have a total of 45 graduates over the course of 2 years. So we ran the program twice in 1 year. And luckily, I just added this, that we have a continued partnership interest with the local health authorities. So we're excited to know that the health authority is willing to continue supporting the program because we really believe in its impact. I'll just pause for a second. Don't let shame decide was mentioned earlier, and I chose not to include other Totally Outright outcomes in this presentation, but there were 2 other ones that are really great, and hopefully next year I can come back and talk about all 3 of them in one big bundle. The first one was Don't Let Shame Decide, and you can access the video and the website at don'tletshamedecide.com, and it is so beautiful. It's a really stunning campaign that the Regional Health Authority saw and decided to throw a bunch of year-end money at us to be able to produce it. So we do actually have all the materials produced. We have these little condom kits and posters and postcards and a website, and unfortunately over the course of the past year, priorities and funding has changed a little bit in our organization, so it's sitting still at the moment. So it's not gone, and it will live, and you know, if I have to do it myself, I'm going to make sure it grows into something bigger than it is, but it is really beautiful as it is already, so I'd encourage you all to check it out. The second year of the program, and these were all part of our engagement strategies, so one thing that's not necessarily unique to Winnipeg's Totally Outright program, but kind of different, is that in building the program, we also build the post-program activities into the funding, so we get money to actually support an engagement strategy. And as other people have mentioned on the panel, there's this real burning energy that emerges from the guys who graduate the program, and you really need to tap that. Like you need to harness it, you need to support it, you need to facilitate it, because it's beautiful and it has to happen, and really good things come from it, as you can see. So the second year, the engagement strategy was based on community-based research. Some guys in the group that wanted to continue with the program identified a need to look at the difference between the rural experience and the urban experience of gay and bisexual men in Manitoba. So they developed a big survey, and they've actually the guys who took the project on and really ran with it just finished their preliminary report. So I got that data 3 days ago, and I was really hoping to maybe work that in somehow, but I think it's for another time. So I'm here to talk about the third year's, our most recent program's engagement strategy production, but we'll get to that in a second. So, Winnipeg Context, what are young guys dealing with? Some of you might have seen the Maclean's magazine recently that, I think it was in January, that declared that Winnipeg was the most racist city in Canada, or becoming the most racist city in Canada. And interestingly enough, while people were noticing in different parts of the country, people in our community, our queer community, were noticing it as well. We had an incident last year around Halloween where one of the major nightclubs, basically the biggest gay bar we have in Winnipeg, allowed someone to enter the bar in blackface as part of their costume. And it wasn't handled well, and it's sort of a very political issue. So, you know, I tried to, well, I'm not in Winnipeg, so I can say it was utter bullshit. But the thing is that it really started a conversation at the community level that's very real, and people really felt it. And since then, there's been a lot of community discussions and events that have been held, some organized by community members, some organized by the Rainbow Resource Center, to start talking about how racism impacts our lives. So that's a thing. Like it's starting to come up, and then even from the Maclean's magazine, our new mayor has started to do some work around that and plan some conferences and all that kind of stuff. So it's sort of it's on our radar. And if you haven't read the article, I'd encourage you to. It's pretty intense, and there are some critiques. So read it critically, but it's a thing. We still have barriers to accessing adequate health care in Winnipeg, so we do have a gay men's health clinic that's been rebranded as our own health center, and I'm on the board of directors for the clinic. And there's something missing. There's still a gap between young guys walking into the clinic and getting healthcare services. So while it exists, and it's really the only primary healthcare center that offers this specifically to gay and bisexual men, for some reason the guys aren't showing up. Most of the clients are from older generations. We have a syphilis outbreak as recent as, I think, in the past 2 years, that's not showing any signs of going away in the near future, and that's been largely attributed to, of course, social media, Grindr, Squirt, that kind of thing. The health authority is really noticing that when you look at how outbreaks start, there's these sort of nodes and these patterns and these really interesting charts that pop up where you can sort of pinpoint locations where the outbreak commences. But right now, you can't pinpoint those locations because they're digital locations. So they're apps, they're not places, they're not behind a Dollarama somewhere, they're on Grindr, which is challenging for the health authority to kind of manage. So they're doing a lot of outreach and a lot of public awareness campaigns to try to get the word out about syphilis. And recently, so this is sort of anecdotal feedback, and there's no report for 2015 yet, obviously, but a lot of the new infections, or the majority of new infections, are starting to come out in between young gay and bisexual men in Winnipeg now. And interestingly, it's slowly been on the rise since 2009, but in Manitoba is a bit of an outlier where most of our new transmissions occur between heterosexual partners and predominantly around among Aboriginal populations, more up north. So there is a rural and urban divide in terms of where our HIV transmissions are occurring that we don't have data about. But from the people who work in the HIV program, the nurses and the doctors, this is what they're seeing right now. So this is, this is part of the context. And still, there is a lack of community spaces for young guys that aren't sort of fueled by, we have bars, and that's basically it. So we also have a queer support group, a queer men's support group that's emerged. It's very successful, but it's really not accessed by younger guys. It's turned into more of a support program for people who are feeling isolated, but not really the young community. So that's still a thing, and it's something we hear about over and over and over again, like, where do I meet people? Where do I meet people? How do I meet people? There's nowhere to do that. So we're really aware of this. And finally, the most important part, I think, relevant to this presentation is the idea of social dislocation and isolation. So these are things that have come up over the past 2 years from the Totally Outright program, but they're not things that are surprising, right? So there's a growing gap between generations, and there's a lack of mentorship, where older gay men in the community and younger gay men aren't connecting. And this is evidenced actually in sort of the community event that we held in conjunction with this video, which I'll talk about in a second. But it's a real issue because guys aren't really learning anything from people who've been around for a while. So it's causing problems. Obviously, advances in digital and social media leads to a lack of physical social interaction, which is, we're saying, what was the name of the event you're gonna have? Off the Hook? Right, so if like, it would be an uproar if you tried to do that in Winnipeg. I don't know if you're gonna have a good time or an easy time doing it, but I think it's a great idea. But this is contributing to something, right? This is contributing to that sense of dislocation where you're lacking that physical interaction where you can build relationships in a real way. There's really no formal education or leadership outside of Totally Outright. So thank goodness Totally Outright exists in Winnipeg and it's been so successful. But outside of that, there's nothing. There's just a void. The university groups, there's three big post-secondary institutions in Winnipeg, and they have queer groups. But they've got their own agenda, right? So in terms of the kind of topics we cover in Totally Outright, there's no one else really talking about it. So and that there should be more. So really, the result is that guys are feeling isolated from each other and from the community, and then also from themselves, because there's nothing to get in the way of that sort of self-isolating, that internalized stigma, internalized homophobia that we've heard about already today. So, as a result, this is the fun part. The guys in the program this year really zoned in on this idea of, you make out with a guy at the bar on Saturday, and then you see him on Sunday at like a cafe, and he won't even look at you. He doesn't even acknowledge you. Or you're talking to a guy on Grindr, and then you bump into each other in public, and it's really awkward, and you don't talk. And this was like a really concrete way of capturing a feeling that exists in Winnipeg that I think is really unique to Winnipeg because of the lack of social spaces for gay men to gather, and because of a lot of other things. And the guys in the program really, they wanted to do something about it. They're really sick of it. Like they wanted to look at it, they wanted to investigate it, and they wanted to come up with some kind of intervention. So that's sort of an example of how we pitched it to them, or how it was pitched by a past graduate doing a keynote speech at our engagement retention event. So we sort of, as we do in every year, we give a very loose structure as to how to go about doing a group project in Totally Outright, which is consistent, I think, among different programs in the country. And we said, just create a short video that we can screen at our local Real Pride GLBTQ Film Festival, which took place in October. And then make sure it's compelling, and then make sure it starts a conversation. So we left sexual health out of the mix just so that they could be really creative, and our funders were totally okay with this, which is great. And the event was a huge success. They did produce a 5-minute video, like Michael alluded to, in conjunction with a young gay guy who's a film producer. He was actually the person who produced the Don't Let Shame Decide videos, so we knew we had a good relationship with him, and he did really good work, and he was eager to volunteer for us. So yeah, they created the video. We played the video at a little event. And over 100 guys showed up. They marketed the video via Facebook. They took questions from the interviews in the video and created sort of some dialogue on our Facebook event by asking the community the questions. And There was some excitement that was generated, and we held the video before another event that night, so it was really accessible. It was easy to come to it. It was free. It was very local, and it was amazing. We showed the video, and the dialogue that started, although it was really only an hour, was very intense and passionate. And there was people from all different parts of our community talking about why young guys don't connect with each other. So now I want to show you the video, and I need to. Oh, that's me. I need to do that.
Hi, my name is Jonathan.
My name is Logan.
Hi, my name is Steven.
My name is Carrie.
Hi, my name is Jonathan.
Hi, my name is Devin.
Hi, my name is Tony.
I identify as a gay male.
And I identify as bisexual.
As gay.
I am 18 and I identify as two-spirit.
And I identify as a gay man. As a gay cisgender male.
I identify as a gay Asian man.
I first communicated or got involved in the gay men's community when I first started going to the bar, I guess.
I had all of these expectations of what it would be to come to an urban center with a gay community.
Well, coming into the community when you're new, is that fear involved a bit?
Well, I was able to find a lot of men. That doesn't mean I was able to connect with them.
Sometimes it doesn't go as planned, I guess.
Since coming out, there's been 4 cities that I've lived in. In terms of Winnipeg, I'm not sure I would say that it's any worse than other places. What I would say is that there's been a different feel. There seems to be a lot more people who may sort of lead you on. Like I said, there are several people that I've talked to for quite a while who just suddenly stop talking.
But there's a challenge of the community already being kind of like a very close-knit group. It's just already a little daunting, especially when everyone kind of knows each other, and I really suck at meeting new people.
Because there have been a couple times when I've been told outright that I don't want to be friends with you or I don't want to hang out with you.
It's very cliquey, and it's almost hard for new people to come in if they don't have their own group already.
For most of the time here, it's been pretty lonely, pretty frustrating.
It's almost like a sorority where you have to like earn your way in, whereas I think it should just be you and make friends.
Something that has always struck me from going out to gay events in Winnipeg is actually how similar they've become to just general events. It's become more about us being like everyone else. So we've started to kind of mimic those types of cliques and those things that we see in high school in ways that we could have probably never done in high school because we were cliquey. And then that has distracted us away from what we really have in common.
I did meet somebody before and they weren't really as accepting because I have a physical disability.
I've definitely experienced discrimination in the gay community. Doing drag especially is like committing treason.
I mean, you go on Grindr or Scruff and you see profiles that say no Asians.
Heavier people who might be considered overweight or fat.
So the negative experiences I've had with other guys, I think it does kind of stem, not necessarily just from me being bisexual, but from people not really understanding the nature of bisexuality.
If I approach someone on a message board and say hi and they don't respond, I could assume that's discrimination, but I prefer to say they don't prefer to talk to someone like me. I don't feel, in general, too isolated. I'm my own individual. I don't try to change the way I look or live by other people's standards. I just ignore a lot of comments.
Part of the reason why I ended up cutting my dreads was to try to fit into the community. So I kind of, I guess, went more into the conformity and tried to change myself to make myself more appealing to the broader community.
I find like a lot of these consequences are people don't want to come out anymore.
People stay in the closet for a very long time for understandably and I feel like I'm the same way too, in that no one knows. There's about, I can count on my hands how many people I've actually straight up come out to, so.
So what's it gonna take?
It sounds cliche to say, but it's gonna take pride. And you know, I don't mean that as like a one day in a year where we take over the downtown and you can feel safe to walk around the way you are. I mean, it's gonna take an actual understanding of who we are as gay men and what that difference is and how can that difference actually benefit society?
I think there needs to be a diversity of these things. I think we need to start finding each other in places where that can be more inclusive. Things like Grindr are very much set up to be about the looks.
Because I think if we realize that we're all equal and we have, we're all the same and we all want the same things, as to be happy, to have friends, to be loved. If we had a community that was open to that and welcomed new people into it, it would seem a lot happier, I think.
So that's the video. It still needs a couple tweaks before we actually release it. It's going to live online somewhere. We're not sure where yet, but how does this relate to stigma? So throughout our conversations, throughout the program, and throughout the planning process of creating this video, stigma was a very central topic, and it was really identified as a key issue contributing to this problem where guys don't connect with each other. So one thing that came out of our conversations was that young guys lack the tools to communicate with each other across difference and in physical spaces. So in physical spaces because they're just used to sort of communicating online a little bit more, and across difference where they're not communicating with people that are similar to them. So it seems pretty simple, but it is actually kind of a pretty serious problem. And really, they identified that the stakes are really high. So, I mean, the feelings of isolation are so intense, and especially for racialized and marginalized gay and bisexual men, that the risk or the value of taking the risk to sort of reach out to people in fear of rejection isn't worth it. So they sort of stick to themselves. And interestingly enough, I add this note because they're really aware of the idea of intersectionality. So these young guys, and I've mentioned this before at different talks, that they're really aware of how issues of race and social location intersect to really create unique experiences of marginalization, but they don't know how to work with it. So they can feel it and they can talk about it. They have tools to talk about it, but they don't know how to address it. So when all of these three things are combined, we're left with a problem that the young guys in Winnipeg are really aware of and passionate about and are continuing to work on. So the happy ending, because we need to have a happy ending, right? The guys in the program are still engaged. From each run of the program, most of the guys are still in contact with me and in contact with each other, and at least a third of them are volunteering or working in some capacity with LGBTQ people, including young men, but also including youth. So they're really engaged, and we've been able to provide them opportunities to continue working. And they're really bringing what they've learned with them into their lives. So a lot of these guys are taking their new knowledge into their university careers or into their workplaces to try to make changes happen where they can, because unlike Toronto and Vancouver, we don't really have a lot of infrastructure to support gay men's health work. And I want to show you a couple quotes from the guys themselves from this run, so people who were involved in this video. One of them said, "I won't shy away from speaking my opinion, even if people think I'm wrong." So I thought that was really beautiful. I'm not as afraid to point out things to people anymore, so really it speaks to their ability to speak up for themselves and to speak up against things that they don't agree with. And finally, my favorite, because I always pick favorites, rather than finding a better community than Winnipeg, why don't we create something great? And if we were to look at the attitudes and beliefs of the guys coming into the program and then look at them afterwards, this is a perfect example of such an improvement that comes from running Totally Outright in Winnipeg. So that's it. Thank you.